Hello, everyone. My name is Courtney Forehand, and I want to thank you for joining this webinar today on navigating the process for FEMA reimbursement. This webinar is being recorded and will also be posted to our website. For those of you who are unfamiliar with the webinar format, you should see a control panel on the top right of your screen. You will have an orange arrow to the left of the panel, which will minimize the entire box. All participants will be muted for the webinar, but we encourage you to ask questions by typing them into the question box on the control panel. We will hold the Q&A near the end of the webinar, but please feel free to type the questions as you think of them throughout the presentation. At this point, I'm going to hand things over to my colleague, Brandy, for her to introduce our presenters.
Hi everybody, this is Brandy DeLang, Legislative and Policy Advocate for the Colorado Municipal League. Thank you for joining us today. I think we have a very good presentation before us. So today we are navigating the process of FEMA reimbursement, and we're very fortunate to have two very well-qualified presenters. The first one being Michael Haney from the Department of Homeland Security and Emergency Management. He is the Recovery Grant Supervisor, and then Clay Brown, the Central Region DOLA Manager. And he too has gone through quite a few of these type of episodes. So I think both of these folks are well qualified to answer questions and walk us through the process. Michael, do you want to start us off?
Yeah, absolutely. So hello, everyone. So yeah, my name is Michael Haney. So most relevant today, I am the State Public Assistance Officer. That is for FEMA Public Assistance, which is, the grant that we're going to be talking about today, the FEMA Public Assistance Award. And sorry, I've got to actually get my slides up, show my screen. Here we go. I'm not sure which screen it's showing. Can you guys see the slides? I'm sorry.
Michael, we see it looks like a folder that you have opened. We did see your slides before this, though. There it is. We see your slides.
What about now?
Yep, there we go.
Yep.
Perfect.
Okay. Okay, just wanted to make sure which monitor I had showing. Okay, so yeah, so sorry about that. I administer the FEMA Public Assistance funding for the state of Colorado. So FEMA Public Assistance is FEMA's largest grant program that they administer. And we'll just kind of go through it as a really high level. As Brandy was saying, we've been delivering this presentation kind of throughout the state. We've done all of the DOLA regional, all the different DOLA regions for this presentation. We had really good attendance. So really high level, FEMA Public Assistance supports communities to recover from major disasters. And specifically with this event, and why it's highlighted here on this slide, is we have been authorized to get reimbursed for life-saving emergency protective measures. And the eligible applicants are local government, states, tribes, and territories, and a few private nonprofit organizations. But for this audience, definitely all local governments are eligible to apply for FEMA Public Assistance. The way that FEMA Public Assistance works is, as you can see here on this slide, there's what they call the pyramid of eligibility. And the way that this pyramid works is you start at the bottom of the pyramid and you work your way up. So the first question that FEMA asks is, are you an eligible applicant? Again, this audience, all of you are most likely eligible applicants. And then we start asking questions about, well, do you operate an eligible facility? What is the immediate threat? And then do you have eligible work and eligible costs? So again, just, really high level, here's a list of all of the eligible applicants. And again, with this audience, I assume that, most of you fall into that. So ineligible applicants, this program is not for businesses. It's not for private nonprofits unless those private nonprofits provide medical, educational, emergency services, or utilities. And this program is not for individuals. The other thing that we wanted to just kind of talk about really quickly, right off the bat, is there is the potential with this incident for there to be a lot of duplicate funding. Most notably, there's been a lot of funding dedicated to health and human services and the CDC from the federal level, but also state stabilization funds and other sources of funding coming out of the CARES Act. And one thing that is a requirement of FEMA public assistance is that it must be kind of the funding avenue of last resort. And so generally speaking, FEMA, will cover eligible costs as long as they're kind of the last payer in. So if there is another funding source that can take care of the funding, FEMA usually leaves it to the other funding source to take care of that funding. Additionally, with FEMA public assistance, the funds are a 75%, 25% cost share. So if you have, $1 million worth of eligible expenses, FEMA will only cover $750,000 of those expenses, and the other $250,000 is the non-federal share and up to the local municipalities to kind of pick that up. And sorry, a lot of this HHS funding is actually 100% federal share. So, not only does FEMA like to be the last funding or the avenue of last resort, but it also just makes logical sense that you would seek out some of this HHS funding if it might be an eligible cost. So really high level process overview is we've been doing applicant briefings over the course of the last couple of weeks, and then the various municipalities should be registering in FEMA's online grants portal. Once they do that, they can actually apply for assistance by putting in a RPA, or a request for public assistance. And then they must upload quite a bit of documentation. And towards the back half of this presentation, I'm not going to go as in-depth about the documentation that is needed, but they are on the back end of these slides, and we'll just kind of click through them really quickly. But I think for this audience, it's really important to know that there is a lot of documentation that is required because this is a reimbursement-based grant. So because FEMA will pay for 75% of all of your eligible costs, that makes every single penny really that much more important, because FEMA is going to start with what your eligible costs are and then pay 75% of it. It's not like they're just giving you $1 million and say, go spend it on eligible activities. They will only give you as much money as you can properly document. And so FEMA public assistance just works, very differently than a lot of other grants, and it makes the documentation tracking requirements that much more onerous. After you upload documentation, it goes to the Consolidated Resource Center, where the project worksheet is what they call kind of the document that captures what the scope of work is and what the costs are. The CRC, the Consolidated Resource Center, actually writes that project. Then it comes back here to the state and FEMA for us to kind of review it. Additionally, at this step, the local municipalities will have an opportunity to review those costs, and everyone actually has to sign that project worksheet saying that, yes, this is an actual representation of our costs. And then after that process, FEMA actually gives the funding to the state of Colorado, and specifically the Division of Homeland Security and Emergency Management, and we are the grantee of these funds. Everyone else, all the municipalities in the state, are sub-grantees, and DHSEM acts as a pass-through entity. So we actually do need to do another grant agreement for these funds between the state and the sub-grantee. And then we enter into the reimbursement process, where we gather any additional documentation that we need, and then hopefully we move to project closeout from there. So for this disaster, again, we have only been authorized for what they call emergency protective measures, or Category B work. That's just FEMA terminology, Category B. So really high level, the only activities that are eligible right now are those activities which directly save lives or protect public health. So there's some examples here on the screen, such as emergency medical care, medical sheltering, security and law enforcement, and then communications of public health information. are really high level ideas. But again, if you just keep in mind that it needs to be directly tied to the incident and an immediate threat resulting from the incident. The other really important criteria for work eligibility is that the work must be the legal responsibility of the municipality that is undertaking that work. So kind of put another way on this is, it is one thing to take an action because it is the right thing to do. An example would be, if there is a senior center that is privately run in the community and they are asking for food assistance. It may be the right thing for the municipality to actually provide that food to the privately run senior center. However, FEMA is required to actually ask the question, did you have the legal responsibility to actually do that? And they will review your policies and your authorizing statutes to make that determination. And as long as you can demonstrate that it was actually your legal responsibility to perform this work, everything will be okay. However, if you do something, because it's the right thing to do and not necessarily because you have the legal responsibility to do it, FEMA is precluded from actually reimbursing those costs. The next thing I wanted to kind of cover is really some key points on the eligibility of the costs. So first, it must be directly tied to the event. And FEMA, again, is required to make a direct tie to the event. So some of the costs that we here at the state, one would think might be eligible as a direct cost. However, they have been determined to be an indirect cost and thus not eligible. So the best example I have to kind of put this in perspective is, as you know, we have had overwhelming increases in unemployment numbers in the state. And as a result, the state of Colorado needed to allocate $1 million to hire 90 more people to work in our unemployment office to handle all of these increased claims. We went to FEMA and said, are these going to be eligible costs? And the answer was no. And the reasoning that they gave us was the direct correlation between COVID and unemployment doesn't exist. The way it works is COVID caused businesses to shut down, and then those businesses laid off their employees. And because there was an intervening action of the, businesses laying off the employees, it was not a direct result. It was an indirect result of the COVID-19 pandemic. So again, that's just really, really high level how to think about it and how FEMA is interpreting their authorities under the Stafford Act and under FEMA public assistance, is that unless there is a direct tie to the incident, the costs will not be reimbursable. Additionally, other things on cost eligibility is that FEMA is required to review that the costs were consistent with all policies and procedures, including your local procurement procedures, your local contracting procedures. And if those local procedures have been waived, we still need to have documentation that they were waived properly and according to your policies and procedures. Federal procurement rules are still in place and must be followed, as are federal contracting rules. Finally, all costs must be demonstrated to be reasonable. That we're not, as, governments paying too much for a service or an item. All of those things are still in place. The one thing that I really do want to emphasize for this audience, and I really emphasize with the audience that we've done, through the regions, is that the quality of the documentation that we're able to put together is absolutely critical to the timelines for reimbursement. So, if the municipalities are able to put together clear, concise documentation that demonstrates eligibility and has all of the required pieces, hopefully the reimbursement process will only take a few months. However, if the documentation is inadequate and we're constantly having to go back and supplement our files, and FEMA has a lot of questions, generally this the reimbursement process will take years, and that really isn't an exaggeration. We are still closing projects from the 2013 floods due to a variety of reasons, but one of those reasons is because of inadequate documentation. So kind of the rest of the slides that I have here are just really, high level, what costs are eligible regarding to labor eligibility, and then what documentation is required. Again, for this audience, I don't really want to spend too much time on this other than to know the documentation is absolutely critical, and the more that we can do, in the next few months, the easier this process will be, kind of going forward. And that's kind of all I had to say about my slides, but, if Clay wanted to chime in or somebody else.
Thank you, Michael. Clay, do you want to go ahead and cover any of your issues?
Sure. Let me first introduce myself. I'm Clay Brown, the regional manager for DOLA in the Central Region. I've been with the state for 18 years, and during those 18 years, I've worked on recovery efforts of 15 disasters, 8 of which were Stafford declarations. So unfortunately, a little too much experience. We need this to slow down. I want to tell you that what we do is we work cooperatively with DHSEM and the Colorado Resiliency Office to help address short-term recovery needs and then do the long-term recovery planning. And this really came out of the 2013 floods. The state learned a lot. At the time, our resources were totally overwhelmed. And we are much more resilient now and better prepared. Back then, there wasn't a grants management office in DHSEM. It was a pretty small operation. And now we're really lucky to have a robust grants management office. Michael's team is right on top of this and might be the first agency to stand up a funding program for municipalities and counties and special districts. So you're in good hands. The one thing I can't emphasize enough is you need to document everything, and you need to be doing that now and get really, really organized, because there's a lot of paperwork. You'll have a lot of balls in the air and lots of different programs. So the more you can do upfront to prepare for the reimbursements or the grant applications, the better. I would suggest you want to appoint your recovery manager, or in this case, it may be managers. You may want a recovery manager to handle this traditional type of federal aid, and then maybe the other recovery manager focuses on economic recovery. So this one might be a little bit different. But get your grant team stood up, get them familiar with all the programs. If you've had substantial costs, I would recommend try to dedicate that entire team to the effort 100%, because there will be a lot of work generated, and you want to make sure you have the resources. As Michael said, this could go on for a long time. So you want several people who know how to do this, because you might get turnover and things in the organization. And I don't know how long this will go on, and we're still incurring costs, so it could be some time. Michael, back in 2013, FEMA had boots on the ground. They were out working, doing project development with the locals. My understanding that FEMA's changed that operation, so it may be different this time. Could you elaborate on that?
Yeah, thanks for that, Clay, because I do think that that's a really kind of important distinction. So it's kind of a multi-pronged answer there. So one, due to just kind of the situation that we're all living in with the Safer at Home order under Governor Polis, one, getting boots on the ground, is really not allowed right now. So that's one of those, factors in that decision-making process. But the other one that I think is really important to kind of recognize is every single municipality in the entire country was simultaneously declared an emergency and then a disaster declaration. That has never happened before. And so FEMA's system was never really meant to literally handle a project from every single municipality in the entire country at once. So kind of contributing to that is FEMA is going to be relying on the states and the local governments more so than they ever have in the past. And then I think the third piece of it is the nature of this incident is there's really not anything to see, except for setting up, sheltering sites or alternate care facilities. It's not like there's roads and bridges that are damaged. So there's really not the need to have a lot of FEMA boots on the ground. However, with all of that said, thank you for the kind words, Clay. I do want to emphasize that DHSEM does have a Office of Grants Management now, and we do have 12 different people that are public assistance experts on the team right now. And over the course of the next couple of weeks, they will be reaching out to all of the municipalities that have registered in FEMA's grants portal and essentially offering that one-on-one assistance to help you develop these project worksheets and answering any questions that we have for, with regards to eligibility. But in addition to that, we also do have the ability to flag any municipality that we believe needs additional assistance from FEMA. And if we do flag those municipalities, FEMA can assign what they call a project delivery manager to those municipalities. Really, the hope is that, between DHSEM and the local entities, we can kind of, handle, most of the work. However, if necessary, we absolutely can flag these municipalities, and FEMA will provide somebody, to provide kind of one-on-one assistance.
Great, thank you. The other suggestion I would make is that start tracking your unmet needs. As more programs become available, having that information from you will help the state stand up programs to address as many needs as possible. Some of these programs are going to take a while to roll out. We may have one small program in CDBG for a couple, 3 tranches, but there's going to be lots of different places to go. And Michael's staff, I think, and our staff both will do whatever to help you get to the right place. Just a couple other things. I think you might also consider doing some scenario planning, not just for returning to work, but to assist in your recovery planning. Getting that recovery planning going is important because it could lead to a mitigation project or an improvement in your preparedness if this were to reoccur. I think it will help you outline which grants you want to seek for which cost. So you kind of want to map it out almost like a capital improvement plan. Map out who, what, where, when, and how much for each one of those issues you're trying to address. So I think with that, probably ready for questions.
Thanks, Clay. Thanks, Michael. Okay, everybody, as Courtney indicated earlier in the presentation, go ahead and type in your questions into your chat box, and we will go through those questions as they come through and have either Michael or Clay answer them. Hey, while we're waiting for some questions, Michael, Clay, can you talk a little bit about some of the long-term recovery thought process that our folks should have? Clay, I think you started to hit on this, but is there something, or are there things that our municipalities should be considering or starting to document or be thinking about, especially as we do start to move into that recovery process where it means we've got folks entering in back to the workforce and, you know, trying to perform services at their regular level, but maintaining the safety of employees?
Sure. You know, the state's got several agencies working on a recovery plan for the state, and that plan will get rolled out to help you guys in all of your planning. But there's a team at DHSEM, there's a team at the Colorado Resiliency Office, some folks from Division of Local Government, and who else is on that team, Michael? EDIT, Office of Economic Development and International Trade. So a lot of things are going on with that.
Yeah, so I would just kind of echo what Clay's saying is, you know, right now, you know, particularly with the CARES Act funding, you know, there is just kind of a lot of unknowns right now, and, you know, it's going to require some time and some planning. You know, one of the kind of, I wouldn't say unfortunate things, but one of the side effects about, you know, having the public assistance program kind of set up here in the state is I do think that we're a little bit out ahead of some of these other funding sources. And so, you know, unfortunately, we can't answer a lot of those questions other than to say we absolutely know that, you know, this needs to be a whole state response and recovery effort. And the governor has made it a top priority. And as Clay said, you know, a lot of different agencies are all working on this to come up with, you know, a whole state recovery effort.
Okay, everyone, so I'm gonna step in here for a minute and read the questions that we have. It appears our first one is about whether or not the slides will be available. Michael, will you be editing the slides down to that so that we can share them on our website?
Yeah, so actually a couple different things. So one, I think the slides that you have already, if you wouldn't just mind sending those out, I think they're fine as is. However, there is also a YouTube video that I kind of recorded the entire presentation. And I will share that with you guys at the Colorado Municipal League. And if you wanted to share that simultaneously, it might be good so that somebody has the full presentation.
Yeah, that'd be great. Okay. Our next question is from Edward. He says, what about utility waivers, restart fees, electric bills, etc.? Will those be eligible?
Yeah, so we did specifically ask that question to FEMA, and again, it was the answer of it being an indirect cost. You know, one thing that is specifically ineligible under FEMA public assistance is any lost revenue, which we know that there's a lot of lost revenue as a result of this incident, as a direct cause of this incident. However, lost revenue is just not eligible under FEMA public assistance. And then additionally, with you know, orders that you cannot turn off people's utilities and the revenue lost because of that, again, those are all things that FEMA has definitively answered that question that no, they are not eligible for reimbursement.
Okay, our next question comes from Brian. He says, what is the latest on CARES? Is there a better fit for municipalities that do not have life-saving efforts?
So the latest is I have a phone call with the governor's office at 2:30 to get some more information because I really don't know. You know, I do know that there has been quite a bit of money, you know, allocated to community development block grants, just generally. So if you are an entitlement community under CDGB, there will most likely be funding, you know, coming from the CARES Act under CDGB. If you're not an entitlement community, my understanding is that funding does run through Department of Local Affairs, DOLA. And then, you know, there is quite a bit of funding in there for testing and contact tracing as well. And that funding, we don't know how it's going to be administered, but as soon as we as a state kind of, get more information, we will definitely be pushing it out. And then, the other kind of big chunk of that funding is what they call state stabilization funds, which my understanding was, kind of directly allocated to the states as an effort to help stabilize state and local budgets. However, again, there's a lot of, confusion around it and how those things are going to be administered. And as soon as we know more at the state, we will be communicating that in every platform we possibly can.
Awesome. So the next question is from Heidi. It says, will there be other grants available other than FEMA for COVID-19 relief?
So the answer is yes. So we know, in one of my slides, we talked about $10 billion from Health and Human Services funding. So my understanding is about $6 million of that went directly to public health organizations on kind of a allocation basis that, had been set up, years in the past about how those fundings would be allocated. And then the rest of it went to CDPHE to set up our state lab so that they could test for COVID. I know that an additional 10 million, I think, was just given out here recently. Again, I'm not sure, but, I think this will be a kind of a recurring theme is that additional funding will become available. And, as we learn more, we will be communicating it.
Okay, Nicole says that their city has a population of less than 500,000. She says, I believe we are working with Jefferson County for reimbursements. How does that work? Will we submit documentation, to Jeffco or to FEMA directly?
So generally speaking, the answer to that question always is whoever has the legal responsibility for the costs that are being incurred. So generally speaking, that is the local municipality, the city or the town, not the county, because the county has no legal responsibility for those costs. So what you would want to do is register in FEMA's grants portal. And then again, somebody from DHSEM will be reaching out to you to help you with that project development and, kind of interacting with FEMA and getting your project worksheet obligated.
Okay, so next is from Emily. Can you provide information regarding what type of documentation we will need to support a reimbursement request?
Yeah, so in the slides that we'll be sending out, it has kind of, different slides for the different categories of work. So it definitely depends on the type of work. Labor has one set of documentation, equipment another, materials another, and contract expenses another. So all of that stuff is in the slides that will be sent out. And then if you'd like to hear me talk about it, the YouTube video, I get a lot more in depth about what documentation is required.
Tammy says, how long should it take to receive confirmation for us registering with FEMA Public Assistance?
So the process has been slow up until this point. So if you registered, you could have registered, 25, 30 days ago and still be waiting on confirmation. And the reason for that is FEMA, again, has basically had to change their program just for this incident, whereas before there was kind of a lot of different hurdles to getting registered. So for instance, you had to actually be invited by the state to even register your organization in the past. And so FEMA has been updating their grants portal to handle the large influx. And so the state has been holding off on approving those until FEMA made improvements to their system to kind of handle everything. So if you're not approved in the next 2 weeks, certainly feel free to reach out to DHSEM. But, we just now basically got the go ahead from FEMA to start, really getting people into the system. And, somebody from the DHSEM Office of Grants Management from my team should be reaching out to you if you've registered in the next couple of weeks.
Our next one is a two-parter from Darren. It says, do municipalities have to go through our counties to get this funding, or can we submit it on our own?
Yeah, definitely want to submit it on your own. Again, it just kind of comes back to whoever has the legal responsibility. And the way that our governments here in the state are set up, it is almost never the responsibility of the county if, you know, it's an action being taken by the local municipality.
The second part is, does our reimbursement work towards COVID-19 need to be included in our county's emergency action plan to be reimbursed? Or are there other documentation processes or mechanisms for reimbursement?
Yeah, that's not a question that FEMA asks. So strictly speaking from, you know, only a FEMA public assistance standpoint, the answer is no. However, you know, again, you should comply with all your local rules and regulations, but there's nothing that FEMA checks for to see that it's in your EAP.
Next is from Gerald. It says, cities are asking what kind of declaration is necessary. Most have adopted resolutions declaring an emergency based upon national and state declarations. Is it necessary to specifically declare a disaster, or is the terminology critical?
Yeah, so and I'll kind of dig a little bit deeper because I think this question, you know, demonstrates that, you know, they kind of understand. So I want to make sure that I'm getting deep enough to answer their question. So originally, on March 13th, the president declared a emergency declaration for all 50 states and the 4 territories. Later, the state of Colorado put in a major disaster declaration request, and I believe that that was approved a couple of weeks later. And so our declaration went from an emergency declaration to a disaster declaration. To answer the question directly, however, it is not important what your local declaration says. However, I do think it is important for your local municipality to have some sort of declaration. Again, because FEMA is only authorizing emergency protective measures, if you're requesting reimbursement for emergency protective measures, but you have not declared an emergency or a disaster, obviously that is kind of non sequitur. It doesn't make sense that you would be requesting emergency protective measures if you haven't declared an emergency or a disaster.
Okay. Next from Heidi, it says, what options are available if a municipality was not affected initially by COVID, but becomes affected by a possible second wave or later effects after restrictions are lifted?
That's another really great question. So obviously we don't know what's going to happen with this incident. We don't know really when the incident period is going to end. So what will signify the end of this incident period is really what FEMA is waiting on is the CDC director to declare an end to the national health emergency. Now, whether he does that this summer or not, we don't know. But if, let's just kind of live in a hypothetical, let's say in July, they declare an end to the public health emergency. Then, you know, this disaster declaration, you know, DR 4498 will be over, and only costs, you know, incurred between the beginning of the incident period, which is January 20th, until the end will most likely be eligible. Then let's say there is a second wave, we would probably just do the whole process again, where we would request another disaster declaration and we would define a new incident period.
Great. Okay, so next is from Jay. Jay's looking for some guides or examples of what is eligible and states that it seems as if the funds available from FEMA would be more for counties in the state. And question mark.
Yeah, I agree with that assessment, and probably the most comprehensive list. And maybe what I'll do is I'll send this link to you guys so that you can send it out with the slides and stuff. But FEMA does have a page dedicated to the coronavirus, and it's just, FEMA.gov/coronavirus. And there is a lot of, really great detailed information about what they are considering. And there is a page specifically called, what emergency protective measures are eligible, and it has more details than what I went in. So I'll make sure that we send that out with the slides and stuff.
Next is from Jennifer. It says, what would be considered good documentation for wages paid as a result of sending employees home due to caring for a child or patient?
Yeah, so that's another one that FEMA is already answered definitively that most likely would not be a eligible cost. It is not, so the answer that we essentially got is that person needs to take sick leave, and then, you pay them the sick leave that they have accrued. So there's no increased cost associated with that. And if there is a increased cost associated with it, again, it's not a direct result of COVID-19. Again, I'm not here to kind of defend those decisions. I think, the way I phrased it originally is things that would logically make sense to be paid. FEMA has, kind of put a pretty strict interpretation of the Stafford Act, in my opinion, and that cost, unless somebody is directly working in an EOC, or they're working in a hospital, or they're working as an EMT and transporting COVID-19 patients, most of these costs for personnel are not going to be eligible.
Okay, next comes from Jessica. She asks if legal expenses are eligible for reimbursement.
It depends. So most of the time, not, but, it really depends on what exactly, the expenses were incurred for. An example would be, if you disagree with FEMA's determination on, let's say you put something up as eligible, and you put in a request, and then FEMA denies it, and then you decide to appeal that decision. If you win the appeal, your legal fees are paid for. If you lose the appeal, then they're not paid for.
Okay. Carly asks, will overtime costs of PR and communication employees be eligible for reimbursement?
Yes, as long as you can demonstrate that those overtime expenses were, in relation to the COVID-19 pandemic, which, it sounds, like you can, but yes, those expenses for, disseminating public health information would be eligible for overtime.
And Desiree asks if we currently have a contracted communications team and they have been providing communications and public information. Should we have entered into a new contract with them for these hours?
Not necessarily. It depends on what your original contract structure was, and then maybe what your task order process was for this. But it'll be one of those, kind of the devil's in the details type situations. It'll go back to your original procurement of the firm. How did that go? Your original contract with the firm, does it have all the applicable federal provisions in it? And then, what was the task order process, and did you follow your own local policies and procedures? But on the face of it, it sounds like an eligible expense, but we would just need to dig a little bit deeper to make sure that, we can dot all the I's and cross all the T's.
Okay. And Sarah asks if they need to contact the county for CARES Act funds.
So my understanding is the only, county that is going to be administering those funds is the city and county of Denver, because they were large enough to get a direct allocation of those funds. I do believe everyone else will be dealing with the state directly. And who at the state, I don't know the answer to that yet.
Okay. Don is asking if our municipality has already registered with the system for award management. Do we need to register again for COVID?
So most likely, yes, you do. If you have not registered in the specific website, grantee.fema.gov, then you are not registered in the public assistance system. So FEMA has a different kind of grants portal where they run some of their other grants, such as, EMPG, and that's not the right portal. The specific portal that you want is grantee.fema.gov.
Great. And Darren asks, when do we enter the recovery phase, and do we capture those costs differently? It would seem a Recovery Act would be passed by Congress to begin that phase.
So the term recovery is, a little nebulous, and I think your question definitely understands that it is. So in FEMA terms, broadly speaking, FEMA is not approving or allocating any funding for recovery at this time. So I kind of briefly talked about the categories of work. So FEMA has categories A through G. A is debris removal, B is emergency protective measures. And those two combined are what they call really more response-related projects. And then C through G are really more recovery projects. Now, again, FEMA has not authorized anything other than category B work for this instance. So technically speaking, FEMA does not see this as a recovery incident. However, I think all of the things that Clay was talking about economic recovery and other funding sources and stuff, are extremely important. However, for FEMA public assistance, they do not see themselves as involved in recovery, at least yet.
Okay. Heidi has a follow-up question about her second wave of coronavirus. The question is, what if there is no national or state declaration during a second wave? Suppose it is only affecting small rural communities. Can the municipality, I'm so sorry, I'm struggling here. Can the municipality declare an emergency and be eligible for assistance?
So no, is the short answer to that, but I'd like to expand upon it a little bit, which is the way that FEMA public assistance works is essentially every county in the state has what they call an indicator, where it's essentially it's your per capita times a dollar amount. So our per capita indicators here at the state of Colorado vary from, I think, $20,000 for some counties up to $5 million. Additionally, on top of that, there is a statewide indicator, and our statewide indicator is $8 million. So the way that the process is supposed to work is, let's say you're one of the smaller counties and you go over $20,000 spent. That is a signal that you need state assistance to respond to the incident. So you declare, and then once you at some point, you basically say, state, we can't deal with this incident on our own, and you come to the state, and the state, is expected to kind of help up to an incident of over, $8 million statewide. And then if we as a state can document over $8 million worth of costs, then we can, request a federal declaration, and then we can ask the federal government for help. So I guess the answer to your question is, if it's, just some small rural communities, I still, suggest that you engage with your DOLA regional managers and your DHSEM regional field managers to make sure that, if you need help, that you're communicating with us, because, if you are needing help, there's probably other counties that are also needing help, and we need to gather that documentation so that we may be requesting another federal declaration.
Great. Our next question comes from Lynette. It says, we pay an hourly rate for police trainees to attend the academy. The academy is increasing hours to 50 minimum weekly to catch up on missed time. This puts our police trainees in overtime. Might this be considered a direct cost eligible for reimbursement?
Most likely not. FEMA would probably just determine this to be a increased operating cost because, it's those trainees, that extra overtime work, they're not responding to the incident. Instead, they are just, doing training. It's most likely not going to be eligible. And that's really the way to think about it is if that overtime, they are directly responding to COVID-19, eligible. If not, probably not.
Thank you. Next is from Christy. It says, can a policy override make a budgeted employee's regular hours eligible? And could a regular employee be appointed as a grant coordinator?
All right. Can you read that one again for me, please? Sorry.
Yeah, no problem. It says, can a policy override make a budgeted employee's regular hours eligible? And then it says, could a regular employee be appointed as a grant coordinator?
Okay. Yeah, so this one, again, it just demonstrates a pretty high level of understanding of the program and the slides. So generally speaking, FEMA only considers a budgeted employee, that is somebody that you had budgeted for and you had planned on paying their expenses, regardless of if COVID-19 had happened or not. Generally speaking, FEMA says, well, you had already budgeted for that employee. We are never going to pay for their straight time, even if they're working on COVID-19 related activities, because there is no extraordinary cost associated with that employee. Again, they were budgeted, and therefore you would already plan on paying them. But this question basically says a override. So this is going to be another one where FEMA is going to closely look at that decision. And if it looks like you are making that decision just to increase your federal reimbursement, it will be denied. However, I'm kind of using, hesitant language here because there may be other reasons why you have done that budget override, and I don't want to say no completely. It's more the big picture. If it appears that you're doing that budget override just so you can make their regular time eligible, FEMA will deny those costs. And then on to the second part of the question, yes, you can absolutely make a full-time employee a grant coordinator. And if you have a significant amount of costs, we absolutely, and Clay touched on this, is we absolutely do recommend that you get people in place to administer these funds. Just kind of tacking it on to as a kind of +1 duty to people is a recipe for failure, essentially. It does take time, it does take effort. It can't just be tacked on to an accountant's already full plate. You do need dedicated people to help out with this if you have a significant amount of costs. I mean, if we're only talking about $10,000 of costs, maybe not that big of an issue. Along those lines, FEMA will allocate an additional 5% of your overall award to do administrative activities. So if you have $1 million worth of eligible costs and you can get a project worksheet obligated for $1 million, you will get $50,000 for the administration of the funds. So there is a little bit of budget. It's not a lot of budget, but there is a little bit of budget built into the program itself.
Great. Next is from Desiree. It says, in regards to legal fees, would the hours our contracted legal staff has billed to create new policies for our council members to comply with social distancing be eligible?
I know I keep giving this answer, but most likely not. And the reason for that would be, COVID-19 did not directly make it necessary to interpret those policies. Therefore, it's the policies are kind of the intervening event. Like somebody passed policies, they needed to be interpreted, therefore not a direct cost. And because those, lawyers are not, directly themselves saving lives, they're just interpreting policy, most likely not under this instant. However, there might be a world in which we can at least make an argument. But, the way that the question is posed, I don't see it.
So, Michael, Courtney, let me just do like a follow-up and see if perhaps part of what we're trying to get at here is what I'm identifying. I think perhaps part of the question is, and Michael, my assumption is your answer will be largely the same, but I think part of the question is, following a lot of the executive orders and public health orders, there was a lot of scrambling at the municipal level to understand what that implementation looks like. So for instance, in the case of liquor enforcement, I think a lot of our clerks and a lot of our legal staff quickly tried to understand what an open container looked like under the new regime of emergency orders and public health orders. Similarly with, trying to do enforcement around, say, medical or retail marijuana transactions and open air market type activities. So I'm wondering, like I say, I assume your answer will probably be the same, but I think that maybe is in part of the question that they're asking.
Yeah, and my answer is, still largely the same. And I do want to kind of clarify that, just because, this is my take, it doesn't mean that you guys cannot put these, costs into grants portal and request them. I'm just giving my opinion that they most likely will be denied. And then, what you do with those from then on is kind of your, if you want to appeal that decision, if you want to push FEMA, you can do that. But again, on these kind of interpreting policy type questions, again, all of the signs that we've seen from FEMA and all of the questions that we've, put to FEMA, that are kind of similar is no, it's not going to be eligible because it's not like those, that legal interpretation was directly saving lives. It was indirectly doing so by, interpreting an order.
Great, thank you, Michael.
So the last question I see is from Tammy, again along the same lines, but she asks, with the increase in Zoom meetings, we have had an increase in long distance charging. Will these additional costs be eligible?
Yeah, so we asked this question to FEMA, and again, spoiler alert, they said not eligible. But we asked it a little bit more broadly even, such as any IT costs, computers, VPN licenses, hotspots, anything along those lines, for government employees. And the response that we received was, unless you bought it specifically for somebody that is working on emergency protective measures, so think like a EOC employee, it's not going to be eligible. They're considering it all to be increased operating costs and therefore not eligible.
And I've actually had another question come in, and it says, what about drafting of emergency resolutions, remote meeting policies to help stop the spread of COVID? And then Matthew says, I'd assume those are emergency protective measures.
Sorry, what was the first one?
What about drafting of emergency resolutions, remote meeting policies?
The remote meeting policies is a little bit different just because I can't necessarily say, that was only for, like EOC operations. Like if it was, confined to EOC operations and the people that you were drafting the plans for were directly involved in the response, probably eligible. And so the emergency resolutions one, if you do have, overtime expenses associated with that, it most likely would be eligible.
Great. Okay, so those were all the questions that I see on my end. Brandy, would you like to say anything?
Yeah, so first of all, I want to thank everybody for tuning in. I hope that this was informative for folks that have been listening for the hour. Secondarily, I want to thank Michael and Clay for taking the time out of their day to walk us through the FEMA reimbursement process and also trying to get us to think about some of those longer term scenarios. And then finally, I want to remind folks that those of you who are interested in some of the resources that are available to our more rural communities, we'll be doing a second webinar tomorrow from noon to 1 with USDA Rural Development and their State Director, Sally Clark. So please do make sure that you register and tune into that. And then again, as a reminder, we will make sure that we have a copy of this presentation as well as the links that Michael referenced earlier today for FEMA's website. And we will get that posted onto our website or send it out to folks as quickly as we possibly can. Again, thank you, Michael. Thank you, Clay. We really appreciate you taking this time with us.
Yeah, well, thank you for the opportunity.
All right, thank you.
Yes, thank you.
That includes our webinar for today. We hope to see you tomorrow, and thank you all for attending.